Before proceeding, kindly subscribe my channel so that you didn't miss any notification regarding future uploads of ESIC exam. In this video, I will discuss about previous year ESIC question paper and its first part you all have already saw, and due to shortage of time, I will point out answers only. So the first question is umbilical cord contain. So there are four options and the correct answer is fourth one, that is allantoic artery and vein. Next, the site of fertilization in human is, so there are four options and the correct answer is fourth one, that is fallopian tube. And always remember, fallopian tube also called oviduct or uterine tube. Next is, it is suspected that a newborn may be developing respiratory distress when the nurse absorbs. The answer is first one, flaring nares. Next is, a pregnant client with preeclampsia is receiving magnesium sulfate. What should the nurse keep at the bedside to prepare for the possibility of magnesium sulfate toxicity? So there are four options and correct answer is calcium gluconate. In other words, we can say that calcium gluconate is the antidote for magnesium sulfate toxicity. Next is, gonads develop from embryonic. So there are four options and the correct answer is third one, that is mesoderm. And from mesoderm, or we can say middle germ layer of the embryo, heart, kidney, muscles and connective tissue etc. form. Next is, location and secretion of Leydig cells are. So there are four options and the correct answer is, that is third one, that is testes and testosterone. And always remember that Leydig cells, also known as interstitial cells of Leydig, and they produce testosterone in the presence of luteinizing hormone. Next question is, a freshly released human egg has, so there are four options and the correct answer is second one, that is one X chromosome. The next is, the nurse administer an intramuscular injection of vitamin K to a newborn. The purpose of the injection is to, so there are four options and the correct answer is fourth one, that is provide protection until intestinal flora is established. Next is, after a sperm has entered an ovum, entry of other sperm is prevented by, so there are four options and the correct answer is fourth one, that is development of fertilization membrane. So the next question is, failure of testes to descend into the scrotum is called, so there are four options and the correct answer is third one, that is cryptorchidism. Next question is, which one is produced by mesoderm? The answer is first one, heart and notochord. Next is, in 28 days human ovarian cycle, the ovulation occurs on, the answer is third one, that is day 14. Next is, part of sperm involved in penetrating egg membrane is, the answer is second one, acrosome. And always keep in mind that acrosomes contain digestive enzyme including hyaluronidase and acrosine that helps to break down outer membrane of ovum, that is zona pellucida. Next is, during phototherapy, the nurse should apply eye patches to the newborn eyes too. The answer is third one, that is to prevent injury to the conjunctiva and retina. Next is, a client is admitted to the hospital in active labor. After an amniotomy, the nurse should expect, the answer is first one, that is increased fetal heart rate. Next question is, corpus luteum develops from, the answer is third one, that is Graafian follicle. Next question is, corpus luteum secretes, so there are 4 options and the correct answer is third one, that is progesterone. Now the next question is, preparation of sperm before penetrating ovum is, so there are 4 options and the correct answer is fourth one, that is capacitation. Next is, fertilized ovum is implanted in the uterus after, so there are 4 options and the correct answer is first one, that is first day. Next question is, the nurse anticipates that initial treatment of an adolescent with anorexia nervosa should specifically include, so there are 4 options and the correct answer is fourth one, that is correction of electrolyte imbalances. Next question is, a child has cystic fibrosis. The nurse evaluates that the parents understand the dietary regimen for their child when they say they will. The answer is third one, that is provide high calorie foods between meals. Now next is, when assessing a child with chronic hypoxia, the nurse should monitor for, there are 4 options and the correct answer is first one, that is clubbing of fingers. Next is, the nurse teaches the parents of a child with fever, headache and stiff neck that the test used to confirm the diagnosis of meningitis in a child is a, there are 4 options and the correct answer is second one, that is lumbar puncture. Next question is, the nurse is caring for a child with a very low platelet count related to chemotherapy. The nurse should monitor this child's urine for the presence of, the answer is third one, that is erythrocyte. Next is, after receiving immunization for diphtheria, tetanus and pertussis, a child develops swelling and tenderness at the injection site, low grade fever and malaise. The pediatric nurse informs the child parents that, the answer is third one, that is this is a mild reaction and teaches how to manage it. Next is, after 1 hour after birth, the nurse can expect a neonate to be, So there are four options and the correct answer is third one, that is relaxed and sleeping quietly. A 4.5-year-old child is brought to the emergency department with a fractured tibia. The nurse knows that in a children of this age, the most frequently encountered type of fracture is classified as, that is first one, green stick fracture. Other options are wrong. Next is, which behavior should the nurse recognize as the mororeflex response? So there are four options and the correct answer is first one, that is extension of the arms. Next is, within 3 minutes after birth, the heart rate of a healthy, alert neonate may ranges between. So there are four options and the correct answer is third one, that is 110 and 160 beats per minute. Next is, at 10 hours of age, an infant has a large amount of mucus and becomes cyanotic. What should the nurse do first? There are four options and the correct answer is first one, that is suction. Next is, a newborn has small whitish pinpoint spot over the nose, which the nurse knows as caused by retained sebaceous secretion. When charting this observation, the nurse identified it as, so there are four options and the correct answer is first one, that is milia. Next is, what type of immunity is transferred to the fetus through the placenta? So there are four options and the correct answer is second one, that is passive natural immunity. Next is, closure of the newborn's foramen ovale is caused by. So there are four options and the correct answer is third one, that is an increase in the pulmonary blood flow. Now next question is, after birth of a healthy neonate, the ductus arteriosus becomes the answer is fourth one, that is ligamentum arteriosum. Next is, what is a primary critical observation for Apgar scoring? So there are four options and the correct answer is first one, that is heart rate. Next is, the nurse should explain to a client that breastfeeding is always contraindicated with. So there are four options and the correct answer is first one, that is mastitis. Now next question is, a newborn is diagnosed as having Erb's palsy. The nurse is aware that this problem is caused by, so there are four options and the correct one is fourth one, that is an injury to the brachial plexus during the birth. During a vaccination drive at a well baby clinic, a nurse observed that a recently hired nurse is not wearing gloves. The nurse should advise the newly hired nurse to, the answer is second one, put on gloves because standard precautions are required. Next question is, Play during infancy is important because it enhances. So there are four options and the correct answer is second one, that is physical development. Thanks for watching my video. Kindly subscribe my channel and hit notification bell icon so that you didn't miss its next part. Till now, goodbye.